See, in this, which type of extension did we use? In this we use the bar type of extension, but here we use the V-shaped gingival extension. Okay, so yeah, and hence advocated crown and band appliance with distal intragingival extension. Okay, so here we are going to use the V-shaped gingival extension. Now because of this, it provides a broader surface area, and hence this is going to prevent the rotation. Okay, so it has two advantages, so why we are going to use the Roche's appliance. Okay, and it has got more advantages rather than that of the Willetts. Now the distal surface of the second primary molar provides the guidance for unerupted permanent first molar. Okay, now the distal surface of the second primary molar, okay, this is going to provide the guidance sequence for eruption of the first permanent molar. Now when the second primary molar is removed prior to the eruption of the first permanent molar, the intra-alveolar appliance provides the greater control of path of eruption for unerupted tooth, and hence prevent the mesial migration. Okay, if what happens is that if the primary second molar, if it has been removed, right, now this is going to provide a control path or path of eruption of the unerupted tooth, which is the first permanent molar, and hence this is going to prevent the undesirable mesial migration. How this is going to prevent the migration? By using some appliance which is called as the space maintainer. Now where this has been indicated? Now this has been indicated in early loss or removal of the second primary molar prior to the eruption of first permanent molar. This is the prime indication. Okay, in maxillary arch with bilateral space loss, two appliances may be used. Okay, in maxillary, if both the premolars have been lost, second premolars have been lost, we can use the distal shoe space maintainer in both the quadrant. Okay, now in the contraindications, inadequate abutments due to multiple teeth loss, poor oral hygiene, poor patient, congenital missing first molar, we can't use this because abutment will be necessary, because we are going to place the first molar, we are going to place a band over the first molar, and then we are going to take a distal extension like this, and we are going to guide this erupting permanent molar. Okay, this is the erupting permanent molar, and this is the first this is the first molar, which is primary, and this is the extension, distal extension, and this is the vertical extension or the gingival extension, right? Now coming to the classification, it has fixed and removable. Fixed itself, it has two, functional, non-functional, and advantage of this is it is durable, it maintains the occlusion, and it can be used after the removal of the extension. But here is here in the non-functional, it is costly, it is time consuming, difficult to construct and adjust. Okay, now coming to the appliance fabrication, how do we construct this? Using the first primary molar as abutment, the stainless steel band has been adapted, and if the morphology of the tooth does not permit the band, then stainless steel crown is prepared and band has been fitted. Okay, so what we are going to do is that using the first primary molar, the abutment is being prepared. Okay, we are going to take the abutment of the first molar. Suppose this is the first molar what we have, and we are going to take it as an abutment. Okay, now since this second molar has been missing, second primary molar, this has been missing, and this is the erupting first permanent molar, right? Now we are going to prepare abutment. Okay, and we are going to fix the band over it. But if the morphology of this primary molar or the first molar has been not okay, we are going to prepare, or we are going to modify this by using crown tooth preparation, and then we are going to fit, and then the band has been fitted. This is the first step. Now what is the second step? Second step is the alginate depression. We take the alginate depression with the help of that band. Now that band in which we are going to take that alginate impression, this has been removed, and this has been kind of put into that impression which has been made, and then we are going to pour out the cast. And now when we are going to pour out that cast, we take the study model, and we are going to take that prepared loop, and we pour the we are going to solder it. Okay, henceforth now we are going to get that band. Okay, now what is next preparation? Distal preparation and the gingival extension, right? Now the primary function of the distal shoe space maintainer is guide the erupting path of the first permanent molar. To fulfill this purpose successfully, we need to have understanding of normal path of eruption of maxillary first and mandibular first permanent molar, because the distal extension of the upper and lower arch differ. Okay, understood? Now here in lower arch, the contact of the distal extension should have slightly lingual portion over the crest of the alveolar ridge. Okay, so logically, if you have to think, in the lower arch, the contact area of the distal extension, it should have the slight lingual portion over the crest of the alveolar ridge. Okay, suppose this is a distal extension and this is the erupting permanent molar. Okay, so this distal extension, it should be lingual to the erupting first molar of the crest of the alveolar ridge in order to engage the mesial contact of the permanent first molar. This is the mesial contact of the first permanent molar, and this is the first primary molar. Okay, so this has to engage lingually. Okay, and this is in case of mandible. Okay, but if this is going to take place in case of maxilla, this should be distal extension, it should be faced facially. Okay, as it is important to prevent the rotation of the tooth and appliance. Okay, so this is about the construction. Now what should be the width? If no adequate width is provided, then the tooth is going to slip, and it should be approximately width of that contact area. So what is that width? It should be approximately width of the contact area. Now, okay, so this would be the width. Now the length of the distal extension or the horizontal bar. Okay, now this thing is called as a horizontal bar. Suppose the tooth. Okay, this is the band and this is the horizontal bar or the distal extension. Now this, it ideally measures the second molar before extraction and remove the same from the model. Okay, first thing. Second, if the second molar is already missing, okay, now measure on the radiograph. You have to take that radiograph and distance between the distal surface of the first primary molar to the distance between the first permanent molar we have to take, and we are going to measure it. So that is going to give us the rough idea of the distal extension or the horizontal bar, how much it should be. But this is going to have a disadvantage. What is that? Overextended. Okay, if it is overextended, then the patient is going to have the problem of food occlusion, food impaction and all this thing, or irritation. No, the best way is to measure the mesodistal width of the second primary molar of the opposite side. Okay, we are going to take the mesodistal width of the second primary molar over the opposite quadrant. Okay, so this is the best idea rather than this. Okay, ideally, if the second molar, if it isn't present, we are going to extract it and we are going to take that mesodistal width, and then we are going to prepare a steady model out of it. Okay, so what should be the depth of the gingival extension or the vertical bar? The gingival extension should be approximately about 1 mm below the mesial marginal ridge of the teeth. Okay, if it is not 1 mm, if it is greater than 1 mm, so what is going to happen? If it is too long, injury to the developing second premolar. Okay, or if it is shortened, then the permanent first molar can be erupted underneath the appliance. Okay, so this would be the depth. Now coming to the advantages, only the space maintainer which can be used if there is premature loss of the primary and second molar before eruption of the permanent first molar. Okay, now what could be the disadvantage? It causes a deviation of the permanent tooth bud, and this is going to cause tipping if not placed properly. So this is going to interfere with epithelialization of the socket, can cause infection. Again, this can be used in specific patients. Retention is not good, construction is also not good, and this is going to be difficult. Okay, so this is about the distal shoe space maintained. Okay, so this is going to come about 10 marks in the university exam, RGHS. So yeah, this much only. Thank you.